Hi, Dr. Josh. I'm so happy to have you with us today.
Well, it's a pleasure for me too. I'm excited.
Yes, well, this is such a great topic to get into because I feel like the word inflammation is this like big, scary thing that we're talking about and hearing about all the time. But what is it? I think a lot of people are like, okay, do I have inflammation? How do I know if I have inflammation? And really have trouble understanding it. So I'm excited to dive in and talk about what it is, what we can do about it today, and get your expertise.
Absolutely. I am too. And I think there's good reason to be excited because inflammation is a buzzword, right? It's on the cover of magazines and it's sort of described as this evil, lurking and underneath and being a cause of so many different diseases, but it's greatly, grossly misunderstood. So yeah, let's jump right into it. Let's start. I think a good place to start is with the word itself, right? So inflammation comes from the Latin word for fire, inflammo. It makes sense, right? Inflammo means to set ablaze or fire. And interestingly, inflammation and fire are very similar in a lot of ways, right? So think about fire for a second. So fire is kind of necessary, right? We use it to heat our homes, to cook our food. It's like sort of one of the inventions or discoveries that led to civilization as we know it. We need and depend on fire, right? But fire can also be one of the most destructive forces on the planet, as evidenced by wildfires in California, my home state, and elsewhere, right? So contained and controlled, fire is amazing, totally necessary. Out of control, if the candlelit dinner lights the curtains on fire, all hell breaks loose, right? So that's the story of fire. And I got to tell you, inflammation, which bears its name, right, is very much the same. It's a biological process. Inflammation is not bad. In fact, it's a biological imperative, which is what people don't realize. It's how we respond to injury or infection or trauma. It's part of the healing response, the process. Now, but when inflammation is excessive or out of control, you have a big problem. And indeed, a problem that can cause pain, a problem that can cause or be an underlying cause of virtually every chronic disease that we know. So that's the way I like to think about it. And I think it's a great place to start our conversation.
Yes, yeah. So before we actually jump in, I just like to give our listeners a little bit of your background and how you kind of got to where you are today. So let's just, if you could just kind of tell us what made you interested in this field and how you kind of got to where you are, and then we'll dive into more specifics.
Yeah, absolutely. So I'm a naturopathic doctor. I have a practice here in Connecticut, and I'm also a co-founder and the medical director of a company called Up Wellness, where I produce content, formulate products, and whatnot. And the road to get there has been, I suppose, circuitous. I come from Southern California, like I said, my home state, and I always wanted to be a doctor. I went to UCLA in pursuit of that dream, studied neurophysiology there. And after my time, or actually during my time at UCLA, I started to understand from the kind of backstage exposure that I got to doctors. My dad was training medical residents at UCLA at the time. So I had exposure to doctors who were telling me that being a doctor kind of like ain't what it used to be, right? And this is like more than 25 years ago. And I took that advice, to heart, and I took off and went on kind of a world travel, sort of you know, traveling on trains and hitchhiking and living out of a backpack, sleeping on beaches, that sort of thing. And long story short, what happened is I got an infection on my foot. My hygiene, I admit, was not perfect at the time. I got cellulitis, which is this bad spreading infection in my leg that really can be limb threatening, even life threatening for that matter. And I was in Europe at the time. I was in Switzerland, and I got a prescription for antibiotics called in, which I needed and cured my problem. Interestingly, well, not surprisingly, Keflex cured the problem. But in that Swiss pharmacy, I saw something that I'd never seen before, which was all this herbal stuff, nutritional stuff, medicine that wasn't medicine, like the orange bottles with white caps that we're so familiar with, a whole world of medicine, which in Europe, it turns out, is like first line therapy, maybe not for cellulitis, but for lots of other things. And that in my early 20s at an impressionable age sort of lit a spark that's still burning, to use our inflammation metaphor here now. It's like, I was sort of entranced by this idea that there's medicine outside of drugs and surgery. And so that spark got lit. And I got to tell you, it's still burning now. Here I am 25 years later, running a clinic and formulating products that are right in that space. So that's my origin story, if you will.
Yeah, that's great. So, and there's so many different aspects and ways we can treat things. And I think we often get boxed into like, okay, you're saying I have the infection, and sometimes you do need the antibiotic. There are times when medication is necessary, but it's just what I'm seeing, I'm sure what you're seeing is that it's just not usually the first thing we should go to, and we're missing all of these other steps before we go to the medication. So to bring it back a little bit into the inflammation, let's start with, just as we're saying, it's the fire burning. When should someone be, you're looking, listening here, and you're saying, okay, do I have inflammation? Is it good? Is it bad? We know it's a biological response. When should we start to be concerned about it, and how do we sort of identify if it's something that we have or we think we have?
Yeah, it's a great question. And again, like if you don't have inflammation, you have a big problem, right?
Yeah,
Especially if
yeah,
there's an
yeah.
injury or a trauma.
Yes, yeah.
So,
I mean, like
yes,
out of control. Yeah.
but that's a good question, right? It's a good question because there's some amount of inflammation is
Mhm.
necessary for healing, but too much or this excessive smoldering fire all the time is a problem. So how do we make that distinction? Yeah, like I said, if you stub your toe or get stung by a bee or a mosquito, you're going to have an inflammatory response. And the danger is when it's excessive or out of control or it burns for too long. So there's two ways to sort of look at this. One is if a person has pain, or immobility or loss of function that is beyond what would expect one would expect based on the mechanism of injury, right? So there's a classic example so many people have experienced. Little fender bender, right? Not that big of a deal, walked away from it, nobody had to call the paramedics or anything, not a big deal. And then 2-3 days later, it's a nightmare, right? Of neck or back pain or whatever the case may be. And then that pain persists for weeks or even months. And now a person's becoming disabled because of that pain. There's a likelihood there that there's more going on than just an injury, right? Excessive, subterranean inflammation would be one of the things that I was concerned about when a person had a response to an injury or a trauma that was excessive, more or longer lasting than it ought to be. That's one way to think about it.
Mhm.
Another way to think about it is just the obvious clinical signs of inflammation. We know there's a little Latin poetry. It goes rubor, dolor, tumor, and calor. And what those mean is redness, pain, heat, and swelling. And so those four things, redness, heat, swelling, and pain, typify inflammation. And so if you have all of those things, again, in excessive amounts or for excessive duration, that's a problem. And then number three, and this is something that's a little harder to do by oneself, but is to talk to your doctor about tests. There's all sorts of blood tests that can be done to evaluate different chemicals in the bloodstream. We can get more specific about those in a minute here, that can evaluate whether or not a person is having a normal or an excessive inflammatory response. Does that answer your question?
Yeah, that's great. Perfect. And can you get into some of the tests? Because I love I love testing. So.
Yeah, yeah, for sure. There's some basic ones that are kind of like that are tests that just tell you, of course, let me frame this for a second. When we take someone's blood, right, we're taking their blood, usually out of their arm, and that blood's circulating all around the place, right? So when we check your blood, we're not checking for inflammation in your ankle or your brain or your heart per se,
Mhm.
right? Because your blood is circulating all around. So we have to be careful with our assessments, of blood work assessments of inflammation because they tend to be non-specific in terms of body parts, right? But there's a bunch of ways to check. The oldest and pretty faithful way to check is something called an ESR, erythrocyte sedimentation rate, also sometimes known as a SED rate. Very simple test. Put a bunch of blood in a tube that's like 100 millimeters tall, and then leave it there for an hour. And as the blood settles out, you'll see this layer on top of serum, and however tall that layer of serum is the sedimentation rate, and the more quickly that the blood settles, the more inflammatory debris there is in the blood. And that's one way to express it. There's another test that's called the CRP, which stands for C-reactive protein. And that's a little bit better, more refined test for inflammation. And when that's excessive, doctors start getting curious and wanting to look, oh, where is the problem? Where might that inflammation be, and use patient stories to determine that. And then we can get into all kinds of details of other cytokines and leukotrienes and prostaglandins that we can check if we're trying to get a little bit more narrow view on things.
Yeah, and I just want to mention that those are very easy tests for your doctor to order at any appointment, and it's not done often, so you might have to ask for those tests. The other thing is that the standard range is not really what we're looking for when we're looking at the answers. So I think sometimes people get the test done if they've asked for it, and then it's like, oh, you're fine, and maybe their number isn't optimal, even though it's standard.
Yeah, you make a great point. I mean, when we look at reference ranges, the reference ranges are determined based on like the so-called average American. And
Mhm.
well, you can take a look at the population, you can take a look at the statistics. I wouldn't want to compare myself to the average American as a standard, right?
Mhm.
Average American right now is nutrient deficient, overweight, sick in all sorts of number different ways, including excessive inflammation, which is rampant. And so,
Mhm.
yeah, you want to look at those reference ranges with an eye for optimal health rather than just the absence of some definable disease state. That's a very good point.
Yes. Well, I see that all the time when people are coming like, well, I was told, we end up seeing them after they've been told they've been fine over and over again, where we're
Yeah,
like, well, actually, even though it's within, I'm using air quotes here,
yeah,
normal, it's not,
yeah, yeah,
it's
yeah,
not
yeah.
really optimal too.
Right.
So yes. Well, let's jump into some natural solutions for inflammation and kind of if we could talk a little bit about kind of how it would be treated in the conventional space versus other options that we're using.
Yeah. So again, here we have this inflammatory response, and it's regarded as this evil thing, and that's both in like culture and society, like I say on magazine covers, but it's also
Mhm.
in medicine too. It's like doctors routinely use powerful tools to reduce inflammation, often when other less powerful, safer, more gentle, less expensive tools would do. Um, I think there's like a fascination compared to my experience in Switzerland, where herbal medicines, this is also in all parts of the world, where herbal medicines or nutritional approaches, gentle approaches get used first, and then you work your way up the line. For some reason, we have this fascination or seduction with the new, the powerful here, and so it's very easy for us to just pull out the flamethrower when a simpler tool would do. And so the flamethrowers, if you will, the sledgehammers in medicine, anti-inflammatory drugs, and that let's start there. If someone has a pain or an inflammation, almost always they will leave with a prescription either for an over-the-counter or a prescription anti-inflammatory drug, and that can span the gamut of over-the-counter non-steroidal anti-inflammatories. That's like your Advil, Motrin, ibuprofen, naproxen, aspirin, those sorts of things, which are not without risk, by the way, and they target a very specific enzyme that's in the inflammatory process, which is really important to know. And then from there, we have prescriptive versions of those drugs. This is the cyclooxygenase 2 inhibitors, COX-2 inhibitors, Celebrex, Mobic, these kinds of things. Vioxx, which is no longer on the market for all kinds of scary
Yes.
reasons back in the
Yeah.
day. And then up from there, we go into steroids, which is like prednisone and related substances, which can be used orally, often in a tapered form, tapered dosage strategy, or by injection. And those are very powerful anti-inflammatories, targeting that inflammatory cascade, but causing all kinds of havoc on tissue integrity and blood sugar and blood pressure in the process. And so, yeah, you have this steady march of pharmaceuticals of increasing power to manage inflammation, and so that's the starting point.
Mhm.
Now, when we talk about natural solutions, I think of like what we've been talking about, like kind of a hierarchy, like a ladder of therapeutics, and it depends on how bad a person is, what the situation is, but the lowest rung on that ladder is the diet, and the lifestyle probably is on a low rung as well, and it's very clear that excessive inflammation that is so problematic is generally caused by indiscretions, problems in people's diets.
Mhm.
Too much of the wrong thing, which is highly processed foods and all the bad oils and all the excessive sugars and stuff that's in the highly processed foods, and then not enough of the good things, right? The good omega-3 fatty acids and the minimally processed foods that are close to the earth. So when you solve that problem, which doesn't happen overnight, but when a person is willing and able to make those kinds of changes, we see that smoldering inflammation get cooler and cooler and cooler, and now you have a more likely to have a normal response to a stimulus. So diet, lifestyle, minimize exposures to toxic things, which they are just everywhere in our homes and outside. We do our best to minimize those. Those are low rung therapeutics, and then we can go up from there.
Yeah, starting with the basics is always a good thing, and that's why you have tools every day that you can use at home, and that's part of the basis of the show. That you can be healthier just by making some of these small changes before you have to do any larger changes. So that's a great place to start. And I think the other thing that you were bringing up with the cyclooxygenase inhibitors, and really is like gut health is a passion of mine, and really seeing the consequences of, well, you're saying these are targeted, they're really strong, maybe not necessary, and you can start with foundational. They also have a lot of consequences
They
too.
do indeed. Absolutely. I mean, I think that's the price you pay for increasing power, right? Is that like,
Mhm.
and you know what's there's a very frustrating thing. It's kind of a linguistic thing, but we talk about these drugs in mainstream medicine as having what are called side effects, right? It's just a common term, like, oh, what are the side effects of this? And the reality is, if we're talking about, let's just say non-steroidal anti-inflammatories, even the over-the-counter ones, they have effects. Okay, there's not side effects. There's effects. The effects are that they lower inflammation by inhibiting cyclooxygenase, and they cause toxicity to the GI mucosa, to the stomach lining, and to the upper small intestine. They're just effects. Some of them are desirable if your knee hurts, and some of them are undesirable if you don't want a stomach ache or a bleeding ulcer. But they're just effects. And I think the idea that like there's drugs and they do some stuff that's good, and then sometimes they do some stuff that's not good, is really just it's a narrow way of thinking about it. These drugs have effects. Some of them are beneficial, some of them are adverse, and I think we should talk about them as such. It's an important point.
Yeah, I love that. Actually, you that I've never heard it said that way. So that
Mhm.
is that's a really good way to say it. They have effects, and
Yeah,
they're we think I always we laugh at our house because it's like when you see the commercial, you see these commercials for drugs
yeah.
like that, and there are these people laugh like happy and loving the effects of the drug, and then you hear this 2 minute like montage of all of the other things it does to
Yeah.
you while the people are smiling and happy, and
Yeah,
we're
and it's usually
ignoring
like,
that.
diarrhea and
Yeah.
death and, all these hideous things, and it's like, I hear my kids too, they're just like, "Who would wanna take that?" I'm
Yeah.
like, "Gosh." Yeah, absolutely, and I think, yeah, I think, of course, the big pharma companies that are selling those drugs directly to consumers that way, right? Like, people are now coming in to their doctors, having seen a television commercial and asking for drugs as a result, so it's an effective, although I think probably inappropriate form of advertising in that way. Um, they have a legal obligation to list out those side effects like we're talking
Mm,
about. And yeah, sometimes they're a real doozy. Yeah.
yeah. Yeah. So let's say someone feels like they've dialed in their diet. What would be the next step you'd advise?
Yeah, so I think the next rung up that ladder is
Mhm.
herbal medicine. That's where my expertise is, and that's where I've had a lot of luck. Both not I don't think it's luck. I think it's a lot of experience and good
Mhm.
seeing lots of benefits in my practice and with my company, which is so herbal medicines for inflammation. I'm going to talk about the ingredients in one particular formula that I made, just because that's a formula that I've used that I think puts forth this recipe really really well. Um, Number one is curcumin. And curcumin is an ingredient, if you will, with active compound inside of turmeric, which is a root. You probably heard of this before. I'm sure your listeners have as well. It's a curry spice, yellow powder. And inside that powder, at a rate of about 2% per unit volume. So there's not very much, but there's curcumin in there. And that curcumin is a powerful anti-inflammatory agent that doesn't just target one enzyme the
Mhm.
way that an anti-inflammatory drug does. It targets a whole sort of spectrum of different enzymes more gently and therefore more safely than a lot of the drugs. So it's sort of more like, I hate to use the violent analogy, but like it's more like a shotgun scatter than a laser focused sniper rifle like a drug is, right? And because of
Mhm.
that, you have a sort of a less powerful effect, but less dangerous effect also. It's sort of more of a blanket.
Mhm.
And so I love curcumin, and I am particularly fond of a particular form of curcumin that's called BCM 95 curcumin, which has a lot of studies on it in human and animal clinical trials demonstrating its benefits as an anti-inflammatory. So BCM 95 curcumin is number one on my list of natural anti-inflammatories. Up from there, or on from there, I would put Boswellia on the list as well. Boswellia serrata is a tree. It's the resin from the bark of a tree that people know of as frankincense. So frankincense is not only an incense that's got this sort of biblical story with it, but it also is a powerful anti-inflammatory, and it's been pitted head to head against conventional pharmaceuticals and performs exceedingly well for people with pain related to inflammation. So Boswellia is high on the list as well. I would put quercetin up there as well. Quercetin is an antioxidant, a bioflavonoid molecule found in lots of foods like onions and apples. That also targets many of the different biochemical um, sort of linchpins in the inflammatory cascade. And so that combination, those three right there, and I could go on, are, I think, a really good foundation for an herbal anti-inflammatory protocol.
Yeah, that's great. And I use those often too. And I have this is a specific question about pain, but I work with a lot of people that have headaches, that chronic migraines, and
Mhm.
we're able to actually reduce them and really try to wipe out the incidence and severity. But they say, well, what if I do have a headache? What should I take? And I often recommend some of the things that you're saying. Do you have any specifics when it comes to headaches?
Yeah, I mean, obviously, and you're doing this work also, it's so important to figure out what the triggers are.
Yeah,
And
that's what
for a
we're doing.
person who has
Hmm.
triggers, which can be all sorts of different things, either
Hmm.
lifestyle, environmental, nutritional, or otherwise. One of the ones that's really big is muscular tension.
Hmm.
Both in migraineur, I love the word migraineurs, right?
Yeah.
It's a French word for people who have migraines. It just makes it sound
Mhm.
so fancy. I would never want to be one, and I have sympathy for the people who are. But for migraineurs, muscle addressing muscle tension, and not just big muscle tension like the muscles in the cervical spine, but also the smooth muscle in the vasculature that goes up and into the brain as well. And so I use a lot of magnesium in
Mhm.
people
Okay, I do
who
too.
have migraines or are at risk for migraines, both acutely and kind of to try to optimize their magnesium status. And magnesium is a big part of a pain reduction protocol, especially in headache patients.
Yes. Okay. Yeah. Yeah. I get the quote. We're always, and it is really amazing. I mean, once you really dial into these things, how much it can be life changing. But people that are regular NSAID users are always like, okay, well, if it happens while we're fixing all of the steps,
Yeah.
what's the magic key? Like,
Right,
well,
right, right, and I
fixing the
mean,
steps. Yeah.
there are ti and I think migraine, especially an acute sort of unilateral
Hmm.
thunderclap kind of
Yeah.
migraine, is the kind of thing that I would yes, we wanna work on those underlying triggers, we wanna reduce the frequency, we wanna reduce the severity, we wanna reduce the duration of your headaches, but I never like people martyring themselves for that cause,
Hmm.
right? Like, if you have a
Yeah.
headache and it's a bad migraine and you know you can abort it with a triptan drug or with a nonsteroidal anti-inflammatory, sure, like, be my guest. I don't want you to suffer, for the
Yes.
cause. And hopefully when our protocols with all of our dietary changes, lifestyle changes, maybe physical medicine that we're doing on a person, nutritional optimization starts to work, then you'll require less and less of that substance that we all don't want you to use.
Yes.
So
Yeah.
that's my take. And I think you
Yeah, that's
agree.
our final goal. So that's what
Of
we
course.
just takes some time, like you're saying, with some of the things, it takes a little bit of time to get there. We
Mhm.
do, but it takes yeah, some time. So you and I were talking a little bit also about some drug nutrient interactions. So can we dial into that a little bit?
Yeah, absolutely. I think it's interesting, right? There's a lot. Most of what you see, if you look around online or talk to your doctor or pharmacist about the interactions between drugs and natural products, like even foods or herbs, is just negative, right? They're just
Hmm.
basically like, don't do it.
Yeah.
Turmeric can thin the blood a little bit, so don't take it if you take this drug or that drug. Or St. John's wort can interfere with the liver metabolism of something, so don't take it. Grapefruit juice, even,
Hmm.
it's all bad news, right? Um, but it turns out actually that there's a lot of situations where drugs and nutrients, or even drugs and herbs, this is a new science, an emerging science, can be used together synergistically. This should be done with caution. So you'll talk to your doctor, your naturopathic doctor, your herbalist about this. But many drugs, just as a case in point, deplete nutrients. They
Hmm.
deplete nutrients. Like, we were talking about side effects earlier. I'll give you an example. Statin drugs, which are used widely to lower cholesterol and lower CoQ10 levels in the body. They're just effects. That's one of them is kind of what a cardiologist wants. Another one is an undesirable effect. And so you can use CoQ10 alongside a statin to offset the deficiency that's caused by the statin. And there's some literature that shows that this actually benefits people. The literature out there is kind of new and emerging, so it's difficult to say with 100% certainty that this is going to help somebody, relieve the side effects of a statin. But it will certainly correct the CoQ10 deficiency,
Hmm.
which is not a good thing. And that list goes on and on. Prednisone causes all kinds of problems, decreases in calcium metabolism, decreases in vitamin D. You can use nutrients to offset some of those problems. And so this is an area of research and clinical practice that I find fascinating, which is the beneficial interactions between natural products and pharmaceuticals for that person who, sometimes needs them. I mean, that's a really novel and intriguing area of research for me right now.
Yeah, and that is great. It's a great point because really we do need to be synergistic. It always would surprise me when I would see someone on a statin and for I'll get them on CoQ10 right away, but that they're not already. It's almost like every time that that's prescribed, you should be giving a CoQ10, recommending CoQ10, and
They should
it's
be
not.
packaged
Yeah,
together. It should just be
they
right
should.
in there with it.
Hmm.
Why not? It's like it's sensible medicine, and I think it's nice to kind of hear because I think like in on both sides, it's unfortunate that there's even sides. We have like this natural or
Yeah.
alternative medicine
Hmm.
side and then the conventional side. And even just describing them as sides sort of suggests that there's some battle, between
Hmm.
the two. And
Yeah.
and indeed there is, right? There's natural medicine people that think there's all Western medicine is just bad, profit driven, big pharma, everything. And then on the other side, on the conventional side, they're like, oh, everything, it's just bad. It's just quackery, snake oil, right? It's not
Hmm.
proven. There's no studies. And the reality is like, a good, healthy, balanced approach to medicine lies somewhere in between. There's
Hmm.
good stuff on the natural medicine side. There's good stuff on the conventional medicine side. Like, can't we all just get along here,
Yeah.
and work in the best interest of the patient? Shouldn't be that simple, and it shouldn't be alternative as far as I'm concerned.
Yeah, you're right. It should just be standard. That yes.
Yeah.
Yeah, well, these are all just such good points. Thank you so much. And thank you for being here today. Can you tell our listeners where they can find you?
Oh, well, thank you for asking that. This was a pleasure. Yeah, you can find me all sorts of places. So the first place to look is at upwellness.com. That's the name of my company where I formulate products. Up Wellness, just like it sounds.com. And then you can join I think it's 65,000 Instagram followers right now at Dr. Josh Levitt. Dr. Josh Levitt is my handle on Instagram. And then I've also been making a bunch of TikToks lately, which is kind of fun. And there's another place to check me out there at Up Wellness. That's the handle on TikTok. So yeah, upwellness.com or any of the social media handles. I'll look forward to seeing you there.
Yeah, well, great. Well, thank you so much for being with us.
It was a pleasure.